Hi, let's talk about legitimate chronic pain using opioids when overreaction to the opioid crisis pressures doctors to taper, discontinue, or abandon a patient with legitimate chronic pain, putting them in harm's way. My name is Cricket Olivia, and I'm a holistic healthcare practitioner specializing in grief, trauma, and addiction. There is a myth in our society that says opioids are bad and they should be discontinued. The truth is, there are people with legitimate chronic pain that do require them in order to have some degree of quality of life, but are being denied this helpful treatment due to the prevailing myth. Did you know that 1 out of 5 Canadians live with chronic pain day in and day out? The chronic pain I'm referring to is pain due to a traumatic injury, arthritis, neuropathy, and various other chronic non-cancer related pain conditions. There is a growing number of our population who, through no fault of their own, are being left to suffer with their chronic pain. I've witnessed this firsthand numerous times, as a growing number of my personal clients are having me attend their medical appointments as an advocate. To allow unnecessary suffering is inhumane when there is pain medication available. The same pain medication the patient was on that worked well for 20, 30, 40 years, giving the patient a degree of quality of life. Here's a scenario I see that is on the increase. A person who has legitimate chronic pain loses their doctor due to the doctor's death or the doctor retires. And the doctor that they have wants to taper the person off of their pain medication, resulting in the patient no longer getting the pain relief to the degree they did, which gave them some quality of life. And now their health is actually declining as a direct result of not having their much needed pain medication. To me and the growing number of clients I represent, this seems to be the opposite to what a doctor has given an oath to do, which is to do no harm. Whose best interest is being considered here, the doctor's or the patient's? Rapid or forced weaning or abrupt discontinuation of their pain medication can and does cause harm to the patient. Intolerable withdrawal symptoms, which I've witnessed, combined with the debilitating physical pain, drives some patients to seek opioids from high-risk sources, which can and does cause fatal overdoses. This also helps to fuel the market for illicit drugs, while prescribed and monitored pain medications have far less of a chance of harming. Feelings of discrimination, stigmatization, and shame set in, worsening the patient's ability to cope with their non-stop physical pain. In harm reduction, the medical profession needs to meet patients where they're at, be supportive of what the patient is choosing without judgment or expectation. You can offer the opportunity to reduce the medication. However, ultimately, the choice and the consequences that go with that need to be made by the patient. They have sovereignty over their own body. To do the opposite, which is what I'm seeing, is to basically force the patient to comply, which causes harm. For deep healing to occur, a person needs to be given the hope of a positive outcome and treated with unconditional positive regard, respect, and compassion, versus treated as though their legitimate need for sufficient prescribed pain medication is somehow their fault, makes them a bad person, or that they may be irresponsible in their usage, despite a history of responsible use of their medication. If this video relates to your own situation, I invite you to contact me. I'd love to hear your story if you want to share it. Also, if you want to have your name added to a petition that's going to the Minister of Health in Ontario, please let me know. You can reach me at cricket@myselfmasterycoach.com. Lastly, know that you are not alone. The situation you're in is not your fault. There are many people like me who deeply care about your situation and want to help you get what you need and deserve from our healthcare system in order to manage your pain sufficiently so that you can have some degree of quality of life restored. Stay tuned for further videos about this topic. Thank you for watching. Please share this video.